January is Cervical Cancer Awareness Month, and a new survey from BD, a leading global medical technology company, finds high rates of misinformation about the disease. Cervical cancer is the fourth most common cancer in women, but is completely curable with treatment and prevention. Joining us to talk more about these new findings is Dr. Taruba Prabhakar, a board-certified OBGYN. Doctor, thank you so much for being with us this morning.
Thank you, Cindy. I'm really excited to be here.
So let's start with barriers to access. The poll found that most women in the United States have delayed their yearly appointment. So why do you think this is happening?
Yes, this recent survey that was commissioned by BD shows us that there is a lack of clarity as to when women should be getting screened, how often, when they start. And in addition, there are other barriers like insurance issues, finding a clinic to get screened, getting an appointment. And in clinical practice, I also see that there's a lot of shame and fear and embarrassment around this test because it is a rather private and invasive test. So we have a lot of work to do in terms of really educating folks on the prevention and screening strategies.
And as you mentioned, the study, finding 60% of women not knowing how often they're supposed to be screened. So what is the recommendation? Because, so often things change over the years. So what is the latest recommendation?
Yes, and that's part of the confusion. We do start cervical cancer screening at age 21, and it should be done every 3 years with cervical cytology, or more commonly known as the Pap test or the Pap smear. And then when you turn 30, we add on the HPV test, and together we do the Pap and the HPV every 5 years, starting at age 30.
All right, another knowledge gap is around the cause of cervical cancer. What are people uninformed about?
Yes, probably the biggest thing I would say is most people are not clear that HPV, or human papillomavirus, is what causes cervical cancer. So this is an entirely preventable disease. There are many strains of HPV, high and low risk, and this is what causes cervical cancer. And by screening, we can actually catch it, and there are things that we can do about it. And cervical cancer is the fourth most common cancer that affects women worldwide. And in the US, we have about 4,000 deaths every year due to cervical cancer. But the good news is that it is preventable and detectable.
And also a possible solution. The survey found that most women are interested in at-home screening. Tell us about that.
Yes, so the at-home screening is a great option and really reduces barriers to access. It is a swab that you insert vaginally, and you don't have to go all the way up to the cervix, and you just kind of twirl it around for 20-30 seconds and you're done. And women can do this in the privacy of their own homes and can really avoid that fear and embarrassment that I talked about before. And this test is currently available around the country around the world in some other parts of the world, but not in the US yet. So I'm really hoping that we bring that up here so we can, again, provide more access to folks.
Oh, definitely. I hope it comes here quickly. Doctor, thank you so much for this important information.
Thank you so much for having me.
We'll be right back.